I'm Catherine Montgomery. I'm 23 years old. I have 3 boys. Wyatt, who's 3, Wayne, who is 2, and William, that is just turned 1 month.
I'm Sean Montgomery. I'm 22. Right now I'm unemployed. I just work around here and try to do what I can without spending as much money as possible.
Wayne was a different story. When he was born, he went into daycare 6 weeks after he was born, and that's the first time that Wyatt actually went into a daycare, was when Wayne went in.
That has helped out a lot with Wyatt, the oldest, because when he gets hurt, he immediately runs to us, and then he shows us his owie or.
Wayne, I think, missed out on a lot of parental nurturing and everything, and now he has to fight for attention, and just makes him a little bit angrier, and I don't know if he's resentful, but he didn't get the attention that he needed when he was younger because we had to go back to work and everything so soon.
He's more edgy and more difficult to talk to, and I think that might be part of it, just because we just pushed him away to daycare so quick.
Wayne gets really upset when we leave him at the child care, even still to this day, and he's been in there for 2 years. And Wyatt's fine with it because he knows that we're coming back. But Wayne every day always has a problem with it. But Wyatt had that full year with me before he went into child care. So, but that first year with him was a struggle financially. So.
I know it's difficult for adults to accept the idea that young children can and do experience pain and suffering associated with their experiences. I think as a society, we'd much rather believe that because they're young, they can't speak, they can't articulate their needs, that in fact, it really isn't mattering so much what's happening and that they'll forget it. And we know from research that that simply isn't true. We know it from neuroscience research, and we know it based on looking at some research that talks about the epidemiology of mental health disorders in very young children, that in fact we are beginning to see that the rates at which young children suffer things like depression, like post-traumatic stress, behavioral disorders, that the rate at which that happens for children in the 2 to 5 range actually is not very different from what you see in older children.